I became a surgeon because I wanted to save lives, and general surgery was the most direct way to do that. A trauma surgeon is someone who takes care of injured people, whether you've been in a car accident or shot or stabbed or fell from a tree stand in Iowa. A trauma surgeon is the one who evaluates you, identifies the injuries, and most of the time we don't need to do surgery. But in the event that you need surgery to save your life, that's where we step in. So one of the major roles of the trauma surgery team is to coordinate the care of multiple different surgical specialties to make sure that the patient gets the best care that they need when they need it. The most rewarding part of my job is easily saving lives. When we don't have a situation where the life is at stake, it's also really rewarding to help people recover from a situation that might be the most stressful and difficult time of their life. I joined the Iowa Clinic, because Des Moines is a great community. Another major reason is that the Iowa Clinic seems to be highly efficient, very patient-driven, and community-focused program. So my patient care philosophy is always to treat the patient like they're my father, they're my brother, sister, grandparents, and also when I'm talking to families, because in my job, a lot of times the patients can't speak for themselves. And so when I approach the families, I always talk to them the way that I would want to be if this were my loved one in the hospital bed. If I wasn't a surgeon, I always thought I'd be an engineer. That was my first career path. And then turns out math was too hard, so I decided to be a trauma surgeon instead. One thing that would surprise people about me is that I'm an avid baker. Honestly, got into the hobby like a lot of people did in the pandemic. There was nothing to do. We were in lockdown for a month and a half in Denver, and had to do something to fill the time and entertain the kids. What I like to do when I'm not at work is mostly hang out with my children. I have a 5-year-old and a 6-year-old. Again, we spend a lot of time out down by the river, fishing, hunting, and just playing outside with the dogs. What I hope patients gain after talking with me is that they really feel that we have their best interests in mind, that we believe that in their recovery, and that they can get better and get well and go back to living their life. I think the Iowa Clinic is the best place to work because it's physician-owned and run. And I think that's a good thing because we are heavily invested in every aspect of your care from beginning to end.